The carnivore diet is a high-fat, meat-based ketogenic diet, but there are thousands of studies on just ketogenic diets using a high-fat, meat-based approach. And we see massive improvements in various health outcomes. We can say very safely that a carnivore diet would help because they're ketogenic diet.
If you've been watching, you know that I take my ingredients very seriously, but there are 3 companies that I have found that I absolutely love. Check the description for discount codes. Hello, welcome to today's show. My name is Adrienne. Today I have with me Dr. Anthony Chaffee. No introduction is really needed, but he is a doctor. And are you still in a neurosurgical residency program, or what is the neurosurgical part?
Yeah, so I work as a neurosurgical registrar is what it's called here. So it's a bit different because you can work sort of as like a neurosurgical resident registrar without being on the official training program. So because I didn't have permanent residency, I haven't been able to actually go on the official training program, but I've been doing the same job since 2020. So yeah, I work in neurosurgery and I also have a private practice in sort of addressing metabolic health issues.
Wow. So on top of all the things you do in our community, you are actually in the hospital and practicing. That
Yeah,
is
yeah.
amazing. My new carnivore friend, she's having issues working because of the loose stool issue. Is
Mhm.
there anything you can suggest for her to calm that down? I keep telling her just time, but she's a teacher and she can't be doing this all day.
The thing is that there can be a lot of things that can cause loose stools. One's what people don't realize is that fiber actually slows down the motility of your digestion. It doesn't speed things up. It actually slows it down. It causes a traffic jam. There's a lot of bulk and it slows it down and it gets in the way. And so when you take away fiber, sometimes things that can act as a mild laxative are much more effective now. And when you're blocking up your pipes with fiber, then having something that as a mild laxative can be very helpful. Or you can get backed up and constipated and have very difficult to pass stools. And that's the thing. The only experimental trials on constipation and fiber have actually shown so you can show a cause and effect relationship with, as opposed to epidemiology. The only experimental trials that have been done with fiber have actually shown that more fiber makes constipation worse, and that less fiber makes constipation better. And actually, no fiber at all completely alleviated all symptoms of constipation and bloating and all these other sorts of things in this trial. And so that's one thing to remember. And so one thing that people do is they go carnivore, but what carnivore really means is you're only eating meat and you're only drinking water and there is nothing else going into your body. Almost everybody drinks coffee. Almost everybody going carnivore keeps drinking coffee. Coffee's a laxative. And so when you get rid of the fiber, that laxative effect is going to be much more pronounced. And so people say, well, I'm still drinking the same amount of coffee, so that can't be it. Well, no, now it's having a greater effect because you're not eating the fiber. And so when you eat meat, 98% of that gets absorbed, it liquefies, it's not solid. And then that coffee can actually push things through too quickly. And now that liquid all just comes out. Because when you're pushing out fiber, it's always going to be solid because it's indigestible. You can't break it down, but you do break down meat and you make that liquid. And is anybody thinking that like, oh, you can't break down meat? Well, what's coming out? Is it liquid or what? Because like there's just chunks of undigested meat, liquid, right? So, there are things that are going to contribute to this. So, coffee, tea, artificial sweeteners, generally in the coffee or the tea, magnesium supplements, and a lot of people that come into this will have other medical issues. They may have diabetes, and metformin and other medications can cause loose stools as well. So, all of those things, if you're taking any of those things, you need to be mindful of that. And if you're drinking coffee, that's the first thing to cut out. You can even switch to like caffeine pills just to have a bit of the energy and not have as much of the laxative effect. You'll still get some from the caffeine, but it won't be nearly as much as the rest of the coffee, because there's 150,000 chemicals in coffee besides caffeine, right? And you just want the caffeine, and yet you're bringing in all these other ones as well. So those are things too. So if it's almost always someone's still drinking coffee, and they just get rid of that, it goes away. If someone's only eating meat and only drinking water, then it can be, like you said, it could just be like, the microbiome sort of changing over, and it just sort of will take a bit of time and it'll go away. But it can also be because you're having too much or too little fat. If you're having, your body has a limited capacity to absorb fat. And that's because you bile. When you make bile, and that emulsifies fat, and then you absorb that into your lymphatic system. Once you finish off your bile, and it takes a day to make about 0.8 liters to 1 liter of bile in total. So it takes like 24 hours to make that much. So eventually you're going to run out. And so the fat after that you eat, you can't absorb it past a small amount, mostly MCTs, medium chain triglycerides. They can be digested and absorbed actually through your liver and not go through your lymphatics. So that bypasses the need for bile. But the rest of it really just goes out. And so that's what keeps your stool soft. So if you're ever constipated, by definition, meaning that you're getting dry, hard, constipated stools, because you only go like once or twice a week anyway, because you're absorbing 98% of the meat that you're eating. But if it's dry and hard and difficult to pass, that's by definition, you're not eating enough fat, because you're not getting enough fat excess in there to soften those up. But if you eat a lot more fat than your body can absorb, it'll come out in a liquid manner. And so you generally want to aim for about 1 to 2 grams of fat to every 1 gram of protein. So it's actually a lot of fat, but there can be more fat than your body can absorb. I mean, you don't eat too much fat because, that can make you fat. It doesn't really. There's really no such thing as too much fat, because you just don't absorb it. If you are just huffing in a bunch of isolated MCTs, or you're taking ox bile or something like that, forcing your body to absorb more fat than it wants, sure. But otherwise, just from a physiological standpoint, if you're just eating natural animal fats and meat and not taking any weird supplements, you'll just absorb the amount that your body wants, and the rest will go out. So it's like an overflow valve. And if you do a lot more, then you'll get diarrhea. I mean, that's it. That's what happens when you overeat fat, but you don't absorb it, so it's not harming you. And the other side of it is that, I said you could get constipated if you're eating too little fat. Sometimes you can get so constipated that it actually does cause a bit of a pseudo obstruction, and you have the liquid stool and you sort of start getting blocked up, and you get this liquid stool coming out of your small intestine, and it actually isn't able to push that hard stool forward. And it's just like the liquid just squirts around the outside, and you get liquid diarrhea. And so you get watery diarrhea, and it's called spurious diarrhea or overflow diarrhea. And what that looks like is that you're getting watery diarrhea, and then every now and then you just get this boulder that comes out, and it's difficult, hard sort of thing, and then it's back to liquid. And so you have to sort of differentiate, because, oh yeah, I'm having, diarrhea or whatever. It's just like, okay, but are you getting that pattern? Are you ever getting hard stools? And it's like, oh yeah, sometimes I'll get this rocky thing that will come out. But no, that's just diarrhea after that. That means you're so constipated that you're actually approaching an obstruction, and you need to really increase the fat that you're eating. And then the far extreme is if you're eating far more protein and getting far more calories from protein than from fat, it can actually be quite irritative to your gut, and you can actually cause liquid stools from that as well. So you have to sort of look at that. Are you eating or drinking any of those things that I mentioned? Coffee, tea, magnesium, artificial sweeteners, or medications like metformin. If you are, get rid of them, insofar as that you can with medication, etc. And if you're only eating meat, only drinking water, then look at how much fat you're getting. If you're getting between 1 to 2 grams of fat to 1 gram of protein, okay, well, then you're probably getting enough fat. It's probably not too little fat. And if you're not ever getting the intermittent constipation, it's just sort of water or liquid diarrhea, or very, very soft running diarrhea, stools, then you're probably just eating more fat than your body can absorb, and you just sort of pull back on that. Sometimes rendered fat, so like the tallow or even butter, is going to go through quicker. If you're eating just the solid fat, then that will have more time to break down and slowly release the fat, so you can absorb that better. It doesn't just go out through your body. Those sorts of things can help as well. But if you're really not eating all that much fat, you're eating just lean meat, you're probably under eating fat, and that's why you're getting loose stools. So there's a lot of So it's sort of a long, complicated answer, but it's there's a lot of different possibilities.
That was really good. I've never heard about the absorbing of fat thing because some people swear
Oh,
you
good.
can eat too much fat. But I just heard about that, how we only absorb 10% of it or something like that. So that's very interesting. Okay, so
After you run out of bile, it's like 10% or less of the fat. Yeah. Before that, you can absorb more, but when you run out of bile, it's like less than 10% absorption, and most of that are MCTs.
everybody I know is losing their gallbladder.
Mhm.
Why? And can the carnivore diet save your gallbladder?
The reason people, and I think this is very, very clear from looking at the physiology of our bodies, that the reason people are losing their gallbladders is because they're not eating enough fat. And, like I said, we have a limited capacity to absorb fat because we make bile, and bile is what helps us absorb fat. It's an expensive material. It takes a lot of energy and a lot of expensive resources to make bile because fat is very important. If fat weren't important and it just harms us and damages us, why would we have 5 organs all working together to absorb fat? Stomach starts to break it down. Liver makes bile. Gallbladder stores it and concentrates it, and that's very important. The pancreas makes lipase and other digestive enzymes that break it down. Small intestine absorbs it. So you have 5 organs all working together to absorb fat. If you didn't have any of those things, if you had one of those things that not working properly, you just don't absorb it. It just goes out, right? And so everything has to be working very well, all pistons firing for you to absorb fat. So if this is just some sort of poison, why the hell would our bodies be working so hard to get in our body? It's not a poison. It's one of the most important and valuable nutrients that exists in nature. And so your body's working very hard to bring it in. When you don't eat fat, because we're told that you shouldn't eat fat because it's bad for you and makes you sick and give you heart disease and cancer and diabetes and make you obese and all this stuff, because we look at fat and we say, ooh, I ate fat and then I put on fat. No, you ate carbs. So you put on fat because it changed your hormones and jacked up your insulin, and insulin forces you to store fat and not use energy. It slows down your metabolism and actually causes you to store fat instead of burning fat. And if your insulin is too high, you will not burn an ounce of fat. You can't. You have to keep bringing in food through your mouth and carbs through your mouth in order to have energy. And then you just keep storing it, storing it, storing it. You use some of it and you store the rest. And so you just keep getting more and more obese. When you are eating fat, then you use that bile. When you're not eating fat, that bile goes into your gallbladder. And like I said, it concentrates. And the physiology textbooks talk about how it can concentrate normally up to 20 times the concentration. So you can have 20 days worth of bile sitting there, hyper concentrated. And so because, predators don't always eat every day, they can't get a kill every day. Herbivores do. They're generally just grazing and just eating, whatever plant that they're eating. They're just eating and migrating. So they keep a steady food supply. Carnivores don't always. They don't necessarily, especially big carnivores that have to take down big animals. Smaller, little lizards eating bugs and stuff like that, or smaller, monkeys that are eating, insects and lizards. They're eating, a whole bunch of little things as they go. But bigger predators, hunting bigger game, they don't necessarily get a kill every day. Lions have less than a 50% success rate, far less than 50% success rate in some areas for hunting. So they're not able to successfully hunt every day, and so it may be once every few days or maybe once a week that they eat. Same for other predators. So they have to be able to concentrate that bile because they need a week's worth of fat in one go, right? Because they can't just, if they're just spilling out this bile and it's just getting wasted and just reabsorbed, then they're not going to be able to absorb as much fat. They're just going to get loose stools. And that fat's going to be wasted. That can't be wasted. That is so important for the life and health of that animal, including us. And so it concentrates and concentrates and concentrates, and we just not eating fat because we're being told that, oh, you eat fat, you get fat. And so we're avoiding it. And what happens if anybody's ever taken chemistry? What happens to any hyper-concentrated solution at rest? Forms precipitate. It forms crystals. That's what bile sludge is. That's what gallstones are. It's the solidification and crystallization of the bile. It's, oh, you're eating too much cholesterol. It's just being forced into your body. No, bile is made out of cholesterol. It's supposed to be made out of cholesterol. It's sitting there and concentrating so that you can have it available for when you get your kill. But if you're going months or years eating next to no fat, that's a problem. And there are probably some people that are more predisposed to it. Maybe they concentrate it past 20-fold, and it past a certain point, it's going to just turn solid. That's just how that works. That's just, it's, it's a state change. It's just, that's chemistry. And so if you're eating enough fat, as in as much fat as your body has bile for, it is physically impossible to ever form gallstones. And so that's because you will never have any bile sitting in your gallbladder for more than 24 hours. And it takes way more than 24 hours to form gallstones. And so even if you were someone that in 24 hours you'd have gallstones, as long as you ate fatty meat every day, you're never going to have a chance, because it's not going to be in your gallbladder in the first place to concentrate and turn into stones. It's not possible. And so when we look at gallstones, we teach this in medical school that the 4 Fs, or the demographic that we most commonly see gallstones and in people. It can happen in anybody, but it most commonly happens in female 40s fertile fat. And so what is that? That's a woman, when middle-aged woman who's just had a couple kids, has a bit of extra baby weight, wants to lose it, and is told, if you want to lose fat, you have to stop eating fat. So they stop eating fat, and they're really starving themselves and trying to, not eat anything and not eat any fat so that they can lose fat. And then all of a sudden that's miserable and horrible and not sustainable. And then they go back to eating normal food that their body is craving, because you have to have fat is required for life, and animal fats specifically. And then you go back to that, and all of a sudden oh gosh, I have this pain. And you go to the doctor and they say, oh, you got gallstones. And it says, because you've been eating too much fat. So no, actually it's because they haven't been eating any fat. And in fact, you see this in bariatric surgery patients. There's a much higher rate of gallstones and cholecystectomies, which is the removal of the gallbladder, in patients who have undergone bariatric surgery, for a gastric sleeve or a bypass or something like that. And what is told and taught is that, well, something strange happens and changes metabolically when we lose a large amount of weight in one go. So, that's why that's such a nothing answer. And you would not believe how many nothing answers there are in medicine. I mean, I'm on the inside of it. So it sounds good to a patient. Well, something changes metabolically. So like, well, they're a doctor, so they understand what those metabolic changes are. And they just don't want, they don't want to explain to me because it's too complicated. Nope. No, they have no idea. There's absolutely nothing. It's pure guess. There's no actual science behind, oh, well, this changes and that. No, no idea. It's a blind guess. But it sounds good, and it gets them out of the room and gets them on with their day. And so people say it. And then it gets taught to the next generation, and, oh, well, there's something going on. Okay, but what is it? No idea. They can't say that. They can't answer that. But something happens. Okay, fine. What I think happens is not that they've lost a lot of weight, how they've lost a lot of weight. These are people that are extremely highly motivated. They're willing to go into the doctor and the surgeon, become mutilated, and have very serious long-term health problems as a result of getting this gastric bypass or sleeve. And some of them, 10, 15 years down the line, they can have very serious issues and need resurgeries. Some people have other sorts of problems, then they need resurgeries right then and there, different complications from the surgeries. They can get stenosis, excessive scarring that can close off, so they can't actually empty their stomach at all now, and have to get resurgery to open that up and get rid of the scar tissue. It's horrible, horrible, horrible stuff. And I've seen people that had these complications, and it said, well, I never would have done it if I knew this could have happened. And it's like, they literally told you this could have happened, but you just don't think that it's going to happen to you, unfortunately. But they can. These are it's rare, but they very serious complications do happen. And either way, you are mutilating yourself. And some people are so desperate to lose weight that they're willing to do that, which I think is a very very sad state. It's a very difficult position for people to be in, and deserves a lot of sympathy. And honestly, I think they're being taken advantage of. Just not necessarily like because the doctors are saying, "Ooh, I'm going to get you," but because they're just not being told the right information, and they're getting having to go down this route when really it should be they just eat a natural human diet. They shouldn't have these problems. And so when you have people like that and they have much higher rates of issues with their gallbladder, I think that's why, because they're so willing to do that. They're willing to do anything, and they're going to be so rigid with what they're told. Don't eat fat. Okay, I'm not eating any fat. I'm getting my surgery. I'm doing this, and I'm losing weight. God damn it! And I'm just going to not eat any fat. I'm going to barely eat anything. I'm just going to eat, twigs and berries, and that's it. And then they lose a lot of weight because they're starving themselves. And, when you starve, anyone can starve themselves into a smaller dress size. Everyone knows that, but it's not sustainable. It's not healthy. It's the concentration camp diet. Like, you can do it, but it's not good for you. And it will have long-term ramifications if you do. And you'll gain the weight back. Yo-yo diet, and your metabolism shuts down, because your body's saying we're in a famine. We need to protect against this famine. And then when you eat anything, it just goes right into fat because you have to store that because you're in a famine. And so you need to store as much as you can and not use anything. And so you regain the weight in your yo-yo diet. But when people are doing this, I mean, I've seen people on these wards that come in, when I'm on my general surgery, when I was on general surgery rotations, for instance, like when I first came to Australia, we saw these women that were in there with gallbladder issues, and they had just gotten bariatric surgery, and it's something like 40% will get gallstones and have to get their gallbladders removed. It's a pretty wild number, and I think it's something like that. I don't know the exact number, so don't quote me, but um, this one lady in particular, she was really upset by this. And she was like, no, I don't have gallstones. Can't possibly be. And so we did the scans and everything like that. We showed that, yeah, no, you do. And you have like, obstructing stone and all this sort of stuff. And, we need to do surgery. And she just said, look, I need some time to process this because I was sure that I couldn't have gallstones because people are told that it comes from eating fat. You eat fat and cholesterol, and that turns into these stones in your body. And that's what we're told. And she said, I was convinced that I couldn't have gallstones because I have not eaten any fat in over 3 months. I have not eaten any fat. And so I just, like, how the hell can I have gallstones? Well, it's because she didn't eat any fat. And they're even more highly motivated to lose weight than a normal person. And they are going to just eat no fat. They aren't going to eat any fat. And those are the ones getting gallstones. If you already have gallstones, sometimes the horse is out of the barn. It's too late to shut the door. But if you just have sludge or their stones are small enough, yeah, you can pass them. And people have, they've reported this anecdotally that they've had sort of symptomatic pains and that has resolved with a high fat diet. High fat, you can be high fat any diet, but obviously a carnivore diet is a high fat diet. And but that just gets things moving, and you start moving this stuff, and you get more bowel motility, and you're moving this stuff out, and you're just clearing the sludge. And if you have a big enough stone that it gets caught, you're going to need help. You're going to need surgery or procedure like an ERCP going down your throat to go in and snake the drain and get that stone out of there, so you don't have that blockage, because that's very dangerous, life threatening to have a obstruction of your common bile duct, and or even your pancreatic duct, meaning pancreatitis and things like that. That's a cause of pancreatitis, is that gallstone getting stuck at the sphincter of Oddi. It's another sphincter, and so it could reverse that if you're at a reversible stage, but there is sort of a point of no return. You have big, massive stones that just aren't going to pass. And, while it's not out of the question that they could sort of dissolve and get smaller and smaller and eventually go away, we don't have any direct evidence of that. But if they are small enough and they can pass, then this will pass them. It may be that you have big enough gallstones and you have a problem, you have an obstruction, and you end up needing gallbladder resection, a cholecystectomy. But again, you only know if you try it and you find out. And if you don't eat any fat, you're definitely going to need your gallbladder taken out eventually, because those stones are only going to grow. They're not going to get smaller, that's for sure.
Can carnivore help people with low bile, weak sphincter, and acid reflux?
Well, there's a lot of different sphincters in the body, so I sort of have to know which one they're talking about. But it can help in a lot of ways. It can help your body and your physiology just work more normally. A lot of people's bodies just work a lot better, and a lot of heartburn issues go away, and other little sort of things they didn't even realize were problems. They just thought that was just a normal sensation. They can just go away. Low bile, I would wonder how they sort of measured that. There's not really a great way to sort of measure that. So when you, unless you have like severe liver dysfunction, you should be making bile. Like if you have extreme cirrhosis or something like that, then sure, you may be under producing bile and other important things that your liver produces, like your clotting factors. But apart from that, you are probably making exactly the amount of bile that your body wants you to make, except that your body can adjust. If we're all sort of eating less fat than we need, and so our bodies, bile is an expensive resource, so it's not going to just try to keep making just tons of it. So it could very well lower the amount that it makes, and that's not. I don't know if we have any hard evidence of that, but there are people that seem to make more bile as they get more fat adapted, and their body starts understanding like, oh, okay, hey, look, we have fat again, and we can do this. So, I would still just eat as much fat as your body can absorb and just allow your body to do its thing. If you have actual liver disease and dysfunction or pancreatic insufficiency or something like that, then, that's fair enough. You might need some help there, but that's going to be the exception, not the rule. It's almost no one in the percentage of the population is going to be in that category. And so most people will be just fine, and you just eat fatty meat until it stops tasting good, and you eat enough fat to keep your stool soft but not runny. And you just go from there. Different sorts of sphincters. I mean, you have reflux. People find that their reflux often resolves because when you're eating carbohydrates, it raises insulin. Insulin affects over 100 different mechanisms and processes in your body. It does not just drive energy into cells. It's a very sophomoric understanding of insulin. It affects all sorts of different things. And one thing that it affects is how much acid your stomach produces. So you can actually become too acidic. We're normally very acidic stomachs. So it's like between 1.5 and 2.0 pH, which is down there with vultures and lions, because we're carnivores and we're also scavengers as well. For a long time, we were just sort of eating whatever was there. We had to contend with a high bacterial load and not get sick from the bacteria. But if you're eating a bunch of carbs, that can raise your insulin. Well, that will raise your insulin, and that will lower your pH even further and become even more acidic. And so you can actually get gastritis and esophageal reflux disease as well. And Barrett's esophagus, these sorts of things. And I've seen a lot of people, improve their reflux. And I've seen a lot of people improve their Barrett's esophagus as well, which is a precancerous change to the lower esophagus. Sometimes, if people are still sort of struggling or having these sorts of issues, sometimes, short-term medication can sort of help with that sphincter tone on the lower end of the esophagus and stop the sort of the reflux. But then it's generally a temporary measure because people after a few months tend to not need that. And so, so it just depends. But so I'm assuming that's the sphincter they're talking about, but I'm not entirely sure. But it can improve your body in a lot of ways. And the thing is too, is that we're not fully aware of everything that it can do. We know a lot of things that it can do, especially with the research that's stemming from the high-fat meat-based ketogenic diets. The carnivore diet is a high-fat meat-based ketogenic diet, but there are thousands of studies on just ketogenic diets using a high-fat meat-based approach, and we see massive improvements in various health outcomes. And so those we can say very safely that a carnivore diet would help with because they're ketogenic diets. And but there's a lot of other things that we're just discovering, and people are recovering from things that we're just like, wow, that's kind of amazing, like congestive heart failure. People are going on a ketogenic carnivore diet, and their ejection fraction goes from below 15 up to completely normal, and off their medications. That's insane. I mean, people just circle the drain and get worse and worse and worse. How horrible quality of life that you can die. It's very, very dangerous. There's a high morbidity and mortality rate. And then, if it gets bad enough, you need to get a heart transplant. Maybe you don't get it in time and you die. And all of a sudden you just change what you're eating, and all of a sudden you have no problem at all and your heart works fine. It's amazing. I mean, it's absolutely mind blowing. So, I'm hoping to put together some case studies, series, and get people on that to publish that. So if anybody, has reversed congestive heart failure, for instance, email me at anthonychaffee@gmail.com and put down the subject, and if you want to be part of that um, case series. So we're seeing amazing things. The best thing to do is just try it yourself, and so see if is it going to help with your specific issue. Maybe there's a lot of evidence that will help with a lot of different things. And so if it's one of those specific things, I can tell you, whether we have evidence that it will or won't. Um, but there's a lot of things that we're still gathering information on, and there's a lot of anecdotal evidence that should be taken for what it is, which is anecdotal. But at the same time, if you do it and you have that same experience, that's the only thing that matters. That anecdotal N of one experience is your life. And so if that happened for you and that benefited you, that's the only thing that matters. And it doesn't matter if it works for other people, it works for you. So give it a try. There's certain things, it depends on what's causing things. You can have problems that don't stem from diet, although a lot of things stem from diet. And so you could fix your diet, and that can help you in a lot of ways, but it's not going to necessarily fix everything, because not everything is caused by a bad diet. It's not gonna all of a sudden reverse a broken arm or something like that. It's just like, well, you broke your arm in another way. It'll help you heal. It'll help your body be better and heal faster and stronger from that broken arm, but it's not going to undo the break. So there are other things that can damage your body. So just give it a try and see what happens. It will help with a lot of things. It's not going to help with everything, but that's what trial and error is for.
These were such good answers. This was such a good episode. Thank you so much for coming on. I appreciate all your time and all your information. If
Mhm.
you like this show, please like, subscribe, and share, and have a great day. Thank you. Bye.
Thank you.